What does $1 million practice look like? How hard is it to get to $1 million? What kind of resources does it take? What's the most important factor in building $1 million practice? I'm going to talk about all of those. If you don't know me, my name's Tony Maritato. I'm a licensed physical therapist, and I got an email recently asking me, what are the numbers behind $1 million practice? And the reality is it's much easier than you would think. The numbers, I'm going to say, don't always line up with real life experience, but let's look at the numbers. I've got a spreadsheet on my computer. I'm going to reference it just so that I can do the math publicly without embarrassing myself, but I will share a link to these numbers in the description of this video. So what does $1 million practice look like? Let's keep it simple. Let's say it's primarily a Medicare-based practice, outpatient, primarily Medicare, preferably orthopedic because that's what I come from. That's my background, so I understand it the best. We can assume $100 average reimbursement per visit if you're doing the traditional business model, 4 units of active therapy. We're going to make some assumptions here. We're going to say each therapist employed by my business is delivering 35 visits a week. Now, it could be a mobile practice. It could be a brick and mortar practice. I'll get into those numbers a little bit later. But if I had 6 physical therapists delivering 35 patient visits a week at $100 average reimbursement per patient visit over a 52-week calendar year, I'm going to generate $1,092,000. Now, obviously, the therapists are going to be taking vacations. They're going to be staggering their vacation schedule, but the clinic itself is going to operate at the volume of 35 patient visits per week per therapist over 52 weeks. If we dive deeper into the numbers, what does that mean? What does that look like? Well, if the average plan of care is 15 visits, obviously some will be lower, some will be higher. If the average plan of care is 15 visits, yearly patient visit total will be 10,920 total patient visits per year. If I'm doing 15 visits per plan of care, we're looking at 728 new patients per year. We're looking at 14 new patients per week. So this starts to make it really achievable, really granular. Now you can start to see, okay, can I generate 14 new patient referrals a week? Can I do 14 new evaluations a week? That's 2.3 new patient evaluations per week per therapist. I think any therapist we know can handle 35 visits a week, can handle 2.3 new patient evaluations per week. So these are totally achievable numbers, right? We know therapists that are out there doing 50, 60, 70 visits a week. I know therapists that are doing 4 and 5 evaluations a day. So to say 2.3 evaluations a week, 35 visits a week, I think it's achievable. If we look at the cost basis for this, right? What is all of this going to cost? Now, remember, I said $1 million practice. I didn't say $1 million in profit. But a reasonable expectation for $1 million in revenue, you have to have at least 2 administrative people, and they have to be 2 solid administrative people. A lot of practices of this size probably going to have 5, but based on my experience, if you have the right systems, you have the right training, we'll talk about that a little bit more in a minute. I think you can get away with 2 full-time admin personnel at $65,000 a year. They're going to cost the practice $130,000 in salary. Then we look at our 6 clinicians at a cost of $100,000 each per year. We're looking at $600,000 in clinical costs. Combine the 2, we're at $730,000 per year. Take that off of the $1,092,000 in revenue. We're looking at $362,000 left over. Now, obviously, we have EMR expenses. We have other expenses. We have insurance, like professional liability and all of those things. If you're running this as a mobile practice, yes, you do save the cost of rent and overhead and equipment. If you're doing this brick and mortar, you're going to have a little higher cost basis. But if you're doing brick and mortar, these numbers are really low for what you would expect to see in a brick and mortar practice. But in any case, if I've got $362,000 left over, I really think that any therapist owner, anyone owning this business who's not working as a therapist should be able to expect a 15% to 20%, probably more realistic 15 to 18% profit margin on this if you're running well, if you're running efficiently. It's not going to happen the first year, but it's certainly going to happen over the next 3 to 5 years. So for $1 million practice, if I'm taking out 150, 180,000 in net profit, I think it's a reasonable investment. You know, if I'm looking to maximize my profit, minimize my risk, I'm probably not even going to get into a physical therapy business. If this is an owner operator, you are one of the 6 working therapists. Now you're pulling out an extra 100,000 a year plus the 150 to 180,000 in profit. I think you're doing pretty well. But my goal in all of this was twofold. One, to say, well, what does $1 million practice look like? Looks like 6 clinicians averaging $100 reimbursement, treating 35 patient visits a week. That's what $1 million practice looks like. On the other element in this is, how do I achieve this? What is the most important element of achieving this? Is it the most amazing therapists in the world, hiring the best professionals, doing all of this other stuff? No. The simplest thing to getting to this is incoming patients. How are you going to get those 14 referrals consistently? How are you going to reproduce that 52 weeks a year? How are you going to make sure that you have the efficiencies in your system so that you can use 2 amazing admin personnel instead of 4 or 5 average admin personnel? It's internal systems, internal policies. It's automating as much of this business as you possibly can. But I definitely think something like this is achievable. You know, we had crossed $1 million in revenue years and years ago in my practice. We were working toward best efficiency, but we weren't at best efficiency. And so, you know, the profit margin showed it. But I think in this day and age, 2023, 2024, with technology the way it is, you absolutely can get to a more than reasonable profit margin without burning your clinical staff out, and really enjoy the experience of being a practice owner moving into 2024. Guys, let me know what you think. I'll share the link to this little Google sheet for you so you can play around with these numbers on your own, and I'll catch you on the next video.